Okay. Please don't dance now. Don't dance now. Please. Don't dance now. Okay. We've been talking about security. We're talking about financial security. We're talking about food security. Now we want to talk about health security. Not too long ago, we got this information that the president of the Actors Guild of Nigeria, Emeka Rollas, confirmed that Nollywood actress Rachel Niga passed recently, and as from complications arising from COVID-19. And so it only goes to emphasize the epidemic-prone infections, infectious diseases, and the threats that have the potential to endanger lives and disrupt economies, travel, trade, you name it, all over our place, including food supply, which we just, stopped talking about. Just about, I think it was last week, we had this conversation around cholera, where thousands of people are said to be in hospital. Hundreds have died as a result of, cholera and all of that. So many things to say about these things. These outbreaks are ongoing. They are a sobering reminder of how every nation of the world is vulnerable and remains vulnerable to emerging diseases, and reinforces the role of global health security efforts in our everyday lives, with or without the pandemic.
And the death of Rachel should bring home the fact, for those who say COVID is not real, it's something out there, it happens to them. They don't know anybody who has died of COVID. They should bring it home that COVID is still with us, and it is real, and it is killing people. And I listened to the president of the US in the course of the week talking about the unvaccinated, and he stressed the fact that most deaths are happening among the unvaccinated. And he even suggested that states in America should offer people $100 each should they decide to go out and be vaccinated.
So this conversation is not just going to end. And as you said, COVID is something that is known to us, but clearly it's not the only one that is affecting people. In our country, we've had a lot more deaths from cholera on its own.
Recently?
Yes.
In 2021, cholera is killing people.
Yeah.
Typhoid.
Malaria, typhoid, and, so many others, which we always know will come because they are usually weather-induced. But this morning, to focus on national health security, we have two gentlemen from the National Center for Disease Control. Dr. Yaya Disu is head of Risk Communication Division, and he is there with Dr. Abiodun Egweno, who is an epidemiologist and coordinator of Antimicrobial Resistance Program of the NCDC. Oh, it's a lady and gentlemen. Thank you so much for being with us this morning. So we say ladies first. So let me begin with the lady, epidemiologist and coordinator of Antimicrobial Resistance Program. Well, that's quite big grammar. We'll begin by first of all decrypting for us exactly what does that mean.
So when you talk about antimicrobial resistance, this is when medications that were previously effective are no longer effective, when infections are no longer responding to treatment. And this is a big issue in the world now. Even during COVID-19, we do know that medications are important for care. If you can recall, when the pandemic started, a lot of the anxiety came from the scientific community because we were encountering this virus for the first time. So without effective treatment or vaccination, it's difficult for us to combat viruses. And antimicrobial resistance is now an issue because a lot of medications that were previously effective are no longer working as they should. And that's just what it means. When medicines are no longer effective because the organism is no longer responding to previous treatment. That is what antimicrobial resistance talks about.
Dr. Egwenu, case in point, malaria and the queens. Is that a good example?
So that is a good example of antimicrobial resistance.
Okay. This COVID business, Nigerians don't tend to believe that it exists, in spite of all the campaigns from your agency, the everyday statistics that you give us about infections and hospitalizations and sometimes even death. When the vaccine was available, a lot of people were rather hesitant. And from the figures which you yourself have given us, NCDC, you said that only about 1% of Nigerians have taken the vaccine. Some more vaccines are expected to arrive soon. What kind of campaign are you going to carry out to ensure that more people go out and get vaccinated?
So since the pandemic started in Nigeria and all over the world, we have been fighting two wars. One is to combat the infection. The other is to combat misinformation. As the virus was newly discovered and new information was arising, a lot of people were also spreading misinformation, some willingly, some unknowingly, because we do know that when there is no information, the nature abhors vacuum. So misinformation can thrive. So the NCDC, with key stakeholders, we have been working to battle misinformation. One of the key ways we've done that is media appearances. We also have a website where correct information can be found, with our stakeholders using their own website and other social media handles. We've been able to propagate correct information. And for the vaccination, the National Primary Healthcare Development Agency is actually in charge of the vaccination. So we work collaboratively with them to spread correct information about the vaccination. And one of the things we should know about misinformation is that it travels borders. Some of the misinformation that we are seeing now in Nigeria has occurred in other countries. And through social media, being the world is now a global village, people can access information from different areas. So and that is why once we detect this misinformation, the same way we respond to the disease, the infection, we track the information, we isolate, and we treat. Treat means that we actually provide correct information to people at that time. And now we are trying to work on what we call building resistance, vaccinating people against misinformation, meaning that before the misinformation comes out, once we detect it outside the shores of Nigeria, if we notice that this is something that might likely cause more resistance to vaccination or to testing or to accessing treatment, then we start providing the correct information before the misinformation goes viral. So these are some of the strategies we are employing at NCDC in collaboration with our other stakeholders.
Well, Dr. Disu, do you still have the same vaccine resistance to truth or correct information? If I'm going to use the analogy that Dr. Egwenu just gave, on the one hand, you have information that is not true. Now, in order to get ahead of more false information, you, what's the word now? Vaccinate people against fake news before it comes. So how successful has that been?
Let me answer that. Misinformation, rumors, whether correct information, any information circulating. Now WHO has adopted a term for that. That is infodemics. Rapidly evolving information. Sometimes they are correct, and then the people get confused, and because things change very fast. And that is one aspect. There was a time we're saying that only healthcare workers should use masks. But when we started having community transmission and asymptomatic transmitters, and then we said everybody should use masks, so people couldn't resonate with that. That is one side. Then on the other side, there are people who spread information that is not correct, the information that is misleading, and then we know what this can do in terms of weakening the effectiveness of this misinformation. And then there are people who deliberately spread misinformation in order to deceive people, either for economic gains or for political gains or for whatever reason. And now, the three strategies for fighting misinformation. First is to the prevention of that is to deliver high quality information to the people in order to avoid vacuum. Then the second one is to debunk the incorrect information in circulation rapidly so that people will know what is correct, and that is what we're doing for now. Then the other two strategies, two approaches, is resistance, campaign against misinformation, like zero tolerance to misinformation. When people know that there are dangers attributed to misinformation, and then they will be able to say no to misinformation. So this even goes beyond health. This is what we need to adopt all of society approach to. Then the building resilience, which my colleague, Dr. Abiodun Igwenu just mentioned, is a way of inoculating people with the ideas of how the tricks behind how people create misinformation, and then the thinking behind that, what is their intention. So when people are exposed to that, sometimes it comes like a game, and then you understand all the antics. So when you see information, the important thing is you first suspect every information you see. Could it be true? What is the intention behind this? So how do I verify this? Where do I verify this? And what do I do with this information? After you have verified it, you know the right source to go to. Then you now know if it is correct information, you can spread that. But if it's incorrect information, you don't spread it, and then you don't act on it. So building resilience is like inoculating people about how misinformation is created, and then the intent behind that. And people, so that we are building resilience at individual level, at community level, societal level, and every other way that we think misinformation can be propagated. So that way we can mitigate the impact of misinformation. So in a situation whereby your response, you may not be able to respond to all the misinformation in circulation. And then the resistance, of course, those who are aware of the dangers, they're able to resist. But there are still some misinformation that will still find their way into circulation, and people may be vulnerable. So in order to reduce vulnerability of the people, that is what this one is talking about. Building resilience at individual and community level.
Dr. Disu, let me just stay with you. The World Bank has drawn attention to food-borne diseases, as well as poor hygiene and food handling. Some would say that Nigerians are quite careless and quite I'm not in a hurry to use the word dirty, but we're not as clean as we should be. Our hygiene leaves a little bit to be desired. Some would also say that this is not a time for us to be eating out, eating mama put randomly because of the cost of food items and the food handlers and food preparers wanting to cut corners. What would be your advice to Nigerians right now in the face of what we're seeing regarding food-borne diseases?
Well, when you look at health behavior generally, there is this approach to understanding behavior, iceberg model. Most of the things you see that happen on the surface are like iceberg, but the real things happen beneath the water that people cannot see, and those are the things that influence what people do. So it's about the value people have for the health. It's about the emotions. It's about priorities. It's about perception, risk perception, and it's also about the way we socialize and socialization. How we understand diseases, and this goes as far as our education system, and then our values at home, our approach towards health, what we teach our children about health, understanding of how disease is spread and what causes disease. When people know this and they are conscious of their health, then it therefore means they will be able to take any precautions, any steps that can safeguard that health. That takes us to what we call health security. And then the health security, when we say national health security, it is not just responsibility of the federal government to safeguard the health of the people. It is at all levels. Health security at individual level, at family level, at community level, societal level, at political level, and then business level, and so on and so forth. So we need to go back to drawing board to begin to reorient ourselves to know what is our value. If you look at the individual level, what do we do about our health in terms of the kind of food we eat, the hygiene, the exercise, the sleep, and the adequate sleep that we need to have? These are investment in health. So when you talk about the state level too, if you look at the budget at the state level or at the federal level, the proportion of the budget that goes into health and is nothing to write home about. So stakeholders need to come together to begin to how we prioritize, to think how we can prioritize our investment in health. But we will need to tell Nigerians, because right now we are having cholera outbreaks across the country. The immediate thing we need to do is to let them know how this is caused. Cholera is caused by a bacteria, and then this bacteria is found in contaminated food and water, dirty environment. It's usually due to poor sanitation and hygiene. And then in some situations, the states have serious role to play to ensure that adequate potable water is available for people, and then sanitation facilities are also available, and then we also have systems to remind people and to continue to give people linkages to health services, and to also monitor what people do, and then to also inform regulations about environmental health practices to ensure that we achieve the collective protection of the people. So this health security is something that we should not joke about. And at the national
I believe
level,
that it is because
the JEE Joint External Evaluation was conducted by WHO in Nigeria in 2017 to understand how prepared are we in case we have a disease outbreak like Ebola that just occurred in Liberia, Sierra Leone, and Guinea, because of its devastation of the economy. So when the JEE was done, and we were able to identify the gaps in our health system, and then in terms of coordination, in terms of resources we need to be able to protect the health of Nigerians, the laboratory capacity, and so on. And then a plan was now developed called National Action Plan on Health Security, and this was done with collaboration of the relevant ministries, Ministry of Health, the NCDC, the relevant MDAs in the health sector, and the Ministry of Defense, Ministry of Water Resources, and so on and so forth. They came together to look at this report and then build a plan that is linked to national plan, strategic plan, the national health development plan for the country, and the strategic plans of different organizations, different MDAs.
Dr. Disu, just one moment. Just one moment.
It enables the country to adopt.
Yeah, just one moment. You said quite a lot of things, and one of the things that you said that I picked on that I think I'd like to you to expatiate a little further on is around funding for, funding health, so to speak. You've talked about the fact that, whatever it is that is budgeted really isn't significantly sufficient to take care of the issues at hand. And I'm just wondering how we'll be able to achieve health security for Nigerians if the resources are not enough. And every year we talk about some infections that always seem to come per weather. Cholera, there was also another fever that, that comes, only in waterlogged areas and stuff like that. I'm trying to remember that one now. I do not. But as soon as I do, not dengue. You know, so that one also happens. It's borne by rodents. I'm trying to remember it. So that one is there. So you're talking about the health, challenge, as well as the fact that we do not have enough resources to tackle these things. So I'm just wondering, would you say that we are really doing anything to take on the challenge of health security? If we know all that needs to be done, we talk about the same thing every year, and we don't have enough resources to take the issues on.
Okay, and let me tell you, the good news is we have made some progress with regards to that. And then one of the recommendations of JE that time was that the bill for Nigeria Center for Disease Control should be passed. And then because that, when they have the mandate to be able to carry out their functions for protecting the health of Nigerians, then they are in a better position to make galvanized actions. That one has happened. Then the multi-hazard plan, that involves security, that involves priority diseases, Lassa fever, yellow fever, and all those things. The guidelines have been developed. We have that multi-hazard plan now that has the buy-in of all the stakeholders. Then workforce development, building state field epidemiologists, and then training surveillance officers at the local government level. The program has been developed, and that one is continuous event. Digitalization of our reporting system to make them real time so that we can quickly pick this outbreak as soon as possible. That's one of the good things COVID-19 has done for us. Before COVID-19, only a few states are using that SOMAS platform, the electronic platform for reporting diseases. But with COVID-19, we have rolled it out in all the states. We have also built public health emergency operation centers in all the 36 states of the Federation and FCT, whereby we now have capacity to respond to emergencies. And then again, issue of routine risk communication and community engagement capacity has been built. But we need more investment. We need more empowerment of the local government, a community to be involved in all these things we are saying. NCDC at the national level and other stakeholders can only provide the guideline, the technical support, and also resources where they need, like prepositioning materials, like for cholera and so on, for cholera response. Okay. So a lot still needs to be done, but we have made some progress. The COVID-19 has also opened our eyes to the gaps in our health system at political level, at professional level, at the public level too. So all these are things that we're looking at. The conference, we had a conference this week. We call it NICAFE Conference, Nigeria Conference of Applied Epidemiology. It was an opportunity for us to look at all the papers that have been written with regards to health security in Nigeria. We have scientists from all over the country and outside Nigeria, chief scientists from WHO, from African CDC, the African CDC director, all of them presented papers. That people learn from. It was a moment of reflection for us, and the recommendations were made, and people from diverse fields, political science, social sciences, epidemiology, case management, they presented papers that we gain insight from on how to move forward next.
All right, thank you, Dr. Disu. Now let me swing to Dr. Egwenu now. Dr. Disu kept interjecting with cholera. And he also at some point referred to one or two causes of cholera. And one of them is defecation. And I remember that Nigeria made a pledge to itself that it would be open defecation free by 2025. Which means, of course, that we should expect a reduction in cholera cases by 2025 or after 2025. But do you see any serious effort at curbing open defecation in Nigeria? Do you see states doing anything specifically to ensure that we meet that 2025 target?
So at the NCDC, we work very closely with the Federal Ministry of Environment on that. They have the mandate to really work with Nigerians on ensuring they have access to sanitation facilities, and there are also indicators both in the country and globally looking at the trends on this. For the Ministry of Environment, a policy was passed making open defecation, banning open defecation. But there are still discussions and also engagement with some key hotspots, especially where people gather. And we have had these discussions with our stakeholders from the Ministry of Environment, seeing how they can support facilities like places, markets, food production facilities, with ensuring that they have hygienic sanitation facilities. It's not something that will happen in one stretch, but it's one of the things that is actually high on the agenda, even for a condition like antimicrobial resistance, especially for bacterial infections such as cholera. We do know that defecation, feces, when it's not properly disposed of, really increases the transmission of many infectious agents. There are many vectors, many insects that can carry disease from such material and into food, especially when they are not properly stored. At the NCDC, we also have risk communication materials disseminated both through interpersonal communication, that is one-on-one communication in the community, and also through media and social media, talking about the importance of storing your food properly, cooking your food appropriately, ensuring that hand hygiene is maintained after food preparation, before food preparation, after going to the restroom, or taking care of kids after they have defecated, ensuring that you perform hand hygiene after taking care of ill people, especially if the person is vomiting or stooling. So these are some of the core messages that have been going out even before the cholera season and during this season, encouraging people to actually keep to hand hygiene practices, one of which the COVID-19 pandemic has shown the importance of. And for the Ministry of Environment, the environmental health officers have been sensitized to also raise awareness in the community with food handlers, and also for the open defecation, there are discussions on how to actually ensure that this becomes a fruition as at 2024, as you have earlier mentioned.
Yeah, Dr. Egwenu, do you see any positive things happening to ensure that we meet this target? Because to my mind, the only way to make sure that this happens is by building more toilets. Because people defecate outside or in anywhere. I mean, they defecate wherever because they cannot find toilets to use.
COVID-19 pandemic, there was a high-level delegation to the Senate where it was approved, and there are school toilet programs also all over the country, because we do know that children also schools are very important places for children to gather, especially where people gather, and transmission can also occur there. So there are already school toilet programs that are already ongoing, where school facilities without toilets are now being provided with these facilities. As I said earlier, this is a stepwise approach to this challenge that you have already highlighted.
Well, Dr. Egwenu, one thing that you began with something that I would like to like you to speak a little more to, because generally, once people feel any ailment, the next thing to do is to just go for that medication that they used before, and, just to take care of it. I have, information about a sickle cell patient who always went for the same medication, which after some time it would seem like the medication just wasn't dealing with the pain that this fellow was encountering for a very long time. And so it probably speaks to the antimicrobial resistance that you talked about earlier. What are the things that people need to know in order to get, to deal with the issue themselves as part of the program that you are on?
Microbial resistance, it's a big challenge, especially since in Nigeria we do know that our coverage for health insurance is still not at the optimal level. It's something that we really are working on. That's with the National Health Insurance Scheme. And we do know that the presidency has really spotlighted this issue, and 1% of the consolidated revenue will be going to support improving or expanding health insurance access. One of the key things that everyone needs to know is if you are ill, it doesn't mean that fever is a symptom for many conditions. And that is why during the COVID-19 pandemic, we actually emphasize and we continue to emphasize testing. The only way you know what is actually wrong and treat appropriately is by testing. Majority of the infections that we do encounter are viral, and majority of them are self-limiting, meaning that they will go away on their own once you rest or take liquids and take nutrients, fruits and vegetables. But what most people in Nigeria really usually do is once they come in contact with a viral infection, then they most likely will go for treatment, even though it's not necessary. So we need to work more on prevention. One of the things I mentioned earlier was hand hygiene. For foodborne infections, hand hygiene is very important. For infections such as malaria, sleeping under insecticide-treated nets is very, very vital. It is one of the key things for those that are very vulnerable, such as pregnant women. Once the person goes for antenatal care, the person will be given intermittent preventive therapy. That is to actually protect the person further, aside sleeping under insecticide-treated nets. And then in addition, if you feel any symptom, the ideal thing and the best thing to do is to go to the hospital, have a test taken, a lab test taken, and then a proper diagnosis by a clinician or a health worker within the facility. We have tertiary institutions, secondary facilities. At least in each local government area, there is one primary healthcare facility. These facilities are there for us to have access to health. So I would encourage people to take to go to those facilities to get proper diagnosis. In addition, vaccination is also one of the key things.
Yeah, we hear you. Yeah, we hear you, Dr. Igueno. I mean, essentially, you are saying if symptoms persist after 3 days, consult your doctor.
Consult your doctor.
And not if symptoms persist after 3 days, take another medication. That's essentially what you're saying, and that's noted. Well, we have to thank you very much, Dr. Abiodun Igueno, epidemiologist and coordinator of Antimicrobial Resistance Program, as well as Dr. Yaya Disu, head of risk communication of NCDC. Both of them are from NCDC. Thank you so much, ladies and gentlemen, for being a part of our conversation this morning.
Thank you.
Thank you.
Well, I guess we do what
I didn't hear what you said.
It's time for the home stretch. After now.